Hey guys, Dr. Nick here from Health Source Chiropractic with our health tip of the week. We're going to cover disc injuries today. You know, a lot of people have had or hear of people that have had a disc bulge or a herniation or something along those lines. Unfortunately, a lot of people really don't understand what that means. So I want to show you on a model what that might look like today to help you understand the importance and severity of these problems. When we look at a disc herniation, we're talking about these soft, cushiony structures that are in between the bones of our spine. And at the end of the day, when we have a herniation that usually occurs from a lift or a twisting type of injury, it's represented by something that could look very similar to this red structure here, where the disc actually herniates out, herniates to the side. You may ask why that's important. Well, the reason that's important is we start to influence all these yellow structures right here. And at the end of the day, these are very important structures because these are our nerves. Okay, the nerves are what go to our organs, our tissues, our muscles, our legs, our toes, etc. So if this nerve gets pinched or it gets irritated, you can imagine that leads to a lot of discomfort and pain. The challenge is how do we get that bulge, that herniation to try to regress? And the answer can be done a lot of different ways. Sometimes it requires surgery. Hopefully that's a last resort. But at the end of the day, we need to do everything we can to restore normal movement, normal function, but we also can use tools like traction and ultrasound and laser to help restore and make this area work like it's supposed to again. Every disc bulge doesn't need surgery. Actually, if we were to MRI 10 to 15 people, 70% of people would have a disc bulge or a herniation to different variations. With that being said, it just depends on what it's putting pressure on. If it's irritating a nerve or pinching a nerve, it leads to a lot bigger problems. So if you have problems or you've been told you have a disc herniation, give us a call. Let us talk to you about what we can do to help, because a lot of times chiropractic can be a huge thing in the treatment and care of patients with disc injuries. That's our health tip of the week at Health Source. I'm Dr. Nick. Give us a call if you have any questions at 882-3726.